We're going to be joined by Tom Romito from Wayne State University School of Social Work. This session is going to introduce you to social work as a profession and the skills that are essential for ethical and effective practice. If you're interested in a career focused on helping others and making a real difference in people's lives, you're definitely going to want to listen to this one. So welcome, Tom, and I'll pass it over to you.
Well, thanks for having me. I'm happy to be here. My name is Tom. I'm from the School of Social Work at Wayne State University. Um, and this particular session is billed as a skills lab. And all that means is I'm going to give you the opportunity to do a little very simple hands-on kind of thing. So in addition to me yapping away for a little bit, there's going to be an opportunity for you to get involved a little bit. Interestingly, I come to the School of Social Work not as a trained social worker and practitioner, but I'm coming to this as a second career. I spent nearly 30 years as a public high school teacher, and recently retired from that, and then took this role in higher ed with the School of Social Work. So I work with the primarily the undergraduate students, providing academic support along the way as they are going through the program. So I have a lot of experience working with young folks and folks in higher ed and now in social work. So like I said, in a minute, I'm gonna ask you or give you the chance to do something hands-on. So before we get started, if you have a piece of paper nearby, something to write with, I'll kind of give you a second to grab that. It's totally up to you. It's not graded. We're not collecting this. But after I present a little information, I'm going to have you ask you to do something. So if you can grab something to write with and write on and kind of draw this on the paper. And I think in the next few minutes, you'll sort of see where we're going with this. But we kind of just do this and set it aside for a moment. So I'll just give you 30 seconds to do that, and then I'll keep rolling. Alicia, is everything appearing good tech-wise and visually and audio?
Yes, everything's looking great.
Okay, cool. All right. So if you're putting that together, great. If you've got it, you can set it aside, and we're going to come back to that shortly. So just some concentric circles. All right. So, a big question that comes up, what is social work? And I do a lot of these kind of in-person career days or, job fairs and tabling. And we get this question a lot. And there is a lot of overlap with what you've been hearing already this morning. But we always, with social work, we always talk about a set of values, a values-based profession that is not just values, but it's values and it's research, and it's about sort of combining those values and research and then creating interventions to improve people's lives, right? Not just individuals, but groups and communities. So I always talk about, people always come to social work. A lot of times they will say, I went into social work because I really want to help people, right? That's always a good starting point. And we refer to social work as one of the helping professions. And that it absolutely is those things. And if your motivation is wanting to help people, that's great. But sometimes I feel that sort of sells the profession short because it's not just about helping people. It's about helping people through some real research-based scientific approaches and understanding theories and systems and using all of that to help people. But if that's your starting point, you want to help people, social work is a great way to do that. And we also talk a lot about collaboration with clients to achieve goals, improve relationships, advance social justice. And I want to mention that idea of social justice for a moment, because that's one of the key values of social work that might not be as prominently featured in some of these other areas. So we really service, social justice, the dignity and the worth of the individual. Hopefully in all these areas, those things are important, but those are stated social work values. So if you're kind of looking at your future and thinking, what do you want to do? If you have a passion for social justice, a passion for the dignity of the individual, and an element of service, you know, giving back to the community, those along with the professional aspects of social work and the research aspects of social work, though if those values are important to you, then social work might be a good fit. Another question that comes up all the time is what type of jobs? Um, and a lot of folks come at this. I heard Dr. Martin talking about this idea of therapy, right? Just wanting to do clinical therapy. And a lot of people come with that in mind. And that is absolutely a direction that you can go with social work. But that's just the tip of the iceberg of what types of jobs social workers do. So we've got a list here, everything from school social workers, community organizer, policy analyst, child welfare specialist, medical social worker, nonprofit executive, holistic defense coordinator, advocacy leader. And you might think, well, there's a lot of uh, diversity within those potential jobs, a wide range of stuff, right? It's not just providing clinical therapy, but we've got an advocacy leader, a community organizer, and social work covers all of those things. We'll talk in a minute. I'll throw out some words like micro and macro. Um, and these are kind of different approaches to social work. Some are focused on individuals and small groups. And then another part of it is working with the system, with communities, with systems out there, with policies, with legislators, state legislatures, federal legislatures, city governments, and saying, how can we change, adjust, fix these policies in these systems to improve lives for individuals? Um, so, with our undergraduate program, um, you don't have to choose any of this. You don't have to pick a focus or a concentration, but our generalist curriculum covers a little bit of all of these things. And most, undergrad bachelor's in social work programs do the same. And then if you continue on to get a master's degree, that's when you have to start to specialize a little bit and say, I want to focus on the micro part or the macro part. And I'll get a little bit more into those in a minute. So what types of jobs? There is a lot of types of jobs. Again, so if your interest is, yes, helping people, but also helping groups and helping communities, and you have a passion for service and social justice, there's a lot of different directions that you can go. The kind of, here's a little bit of some basic practice methods of social work. Again, I heard Dr. Martin talking about the assessment piece and how much she enjoyed the assessment piece. Part of what social workers do is understand client needs, like figure out what's going on. And I mentioned that my background is in teaching. It took me a while to adjust to this idea of assessment in social work as something that comes first, as opposed to when if you're in high school students, you might talk a lot about assessments, right? And that's the tests that you do at the end. Um, but in social work setting, assessment comes first. You got to understand what's going on, right? So whether that's talking with an individual or a family and assessing the situation and understanding the client needs, or looking at the broader system or a broader community or a system of laws and saying, okay, well, what's going on here? What's working? What's not working? Whoops. And then once you've taken the time to do that assessment, then you move on to the intervention piece, which is, all right, well, what are we going to do? Right? If here's a situation, an individual is experiencing some challenges and there's a lot going on, what are we going to do to provide support, to recommend courses of action, right? Intervention, how do we intervene to improve this situation or to deal with this situation? Again, that could be with an individual, it could be with a larger community or a system or a housing program, right? So, what's the situation? That's the assessment. What should we do about it? That's the intervention. And then you also have to think about the evaluation piece. How are we going to know if it works? Right? Are we going to make progress? How are we going to measure progress? And that involves, setting very specific goals and action plans, and then monitoring what happens, making adjustments if that particular intervention isn't having the desired effect. Um, making adjustments and going from there. So assessment, intervention, evaluation, those are some of the just kind of like the basic steps in a social work practice. So again, for this skills lab to kind of zero in on something, one small piece of this, um, we're going to just talk briefly about systems theory. Um, and so, kind of the sort of definition of systems theory is it views individuals as part of an interconnected system where changes in one part influence the whole. Right? It's quite complex, but at its heart, it's really very simple. We are all part of many different systems, right? And that I'm going to talk micro, meso, macro in just a second. But every individual sort of fits in to these larger systems, not only fits into these larger systems, but also affects the larger system. So any changes or adjustments in any parts of these systems can have ripple effects and affect, either positively or negatively these other parts of the system. So we all fit into this larger environment. Another phrase that we use a lot is person in environment, PIE, um, which is just to say that nobody exists in a vacuum, and we are all the product of all of these systems, and not only a product of these systems, but also we have and can have an impact on these systems. All right. So maybe now you might be seeing how those concentric circles are going to come to play in just a minute. But another part of systems theory and a key part of social work is this idea of micro level, meso level, and the macro level. Right. And I sort of alluded before, at some point in your social work journey, you've got to decide to concentrate. Okay, I'm really going to primarily be a micro social worker or a macro social worker. I'm going to work with individuals or I'm going to work with communities and systems. Um, but these phrases also play a role when thinking about systems, right? So the micro level is the closest level to a particular individual. And so this is things like, their own thoughts, feelings, sense of identity, characteristics, um, and things and people that directly is the key there, affect the individual. So certainly immediate family, right? And there's um, some overlap and some blurred lines between these levels. So I'm just kind of speaking on a very broad um, at a broad level here for some basic understanding. Um, but those things in someone's immediate environment that are, again, personal characteristics and also things that directly affect that person. Then you pan out a little bit and you start talking about this meso level. Um, so this is slightly larger groups. All right. So family, friends, school, teams. Now, sometimes immediate family would be identified as part of the micro level, kind of just depending on the nature of those relationships. It might fall into the meso level. Um, but if we're talking about young people, teenagers, peer groups, schools, teams, other organizations that people are part of, that individuals are part of, um, that would be in the more meso level. And then on the broadest level, macro, we're looking at the big systems, right? And to say big systems, it doesn't have to be like this big global thing, but like, what are the policies? What's the culture? What's society as a whole? So this might be, school policies, right? This could be community resources, um, just things that indirectly affect the individual, but certainly have an impact. So if you are, an individual and you're in your in your micro level, you've got the family that lives in your home. All right. Then maybe at the meso level, you've got some peer groups, or maybe you're on a sports team or a club at school. And then at the macro level, you might look at, well, what are these school policies that are having an impact on me? And whether it's attendance policies or dress codes or whatever. And if we're talking, sort of outside of a school environment, then we might be looking at, you know, city laws, state laws, policies. If someone is, having challenges with housing security, then those macro policies are like, well, what are the programs that are available? Community housing initiatives, Section 8 vouchers, what exists, what's working, what's not working. So all of these things are part of a system, and all of these systems influence the individual, and an individual's actions can ripple out to the larger systems. How about this? So again, this is another sort of visual talking about the differences between micro, meso, and macro. Micro, small, immediate environment. Macro is the broader social context, and meso is somewhere in between. And like I said, the lines are blurred. We've got concentric circles that are like hard lines, but there's overlap for sure. So, what I'm going to ask you to do, if you are so inclined, just to kind of get a sense of how this works, is think about. I think the easiest thing would be to think about yourself, right? You as an individual, but let's say you don't want to be particularly self-reflective. You could pick anyone else to do this. You could pick a character in a show that you like. You do Dustin from Stranger Things, anybody, a friend of yours. You could also just make up anyone. Again, the stakes here very low, but it's just to get you thinking about these things. So of course you would put right in the middle of this diagram your name or the name of whoever you're thinking about, right? Um, and then in the micro system is where you kind of put details like, again, these would be things like I'll just keep saying your, assuming that some of you might be doing you, like things that make up your identity. It could be, could be your gender, it could be your religious affiliation, could be things that are really important to you. Maybe you're a musician. So, characteristics that are a key part of you, but then also thinking about other people and things that have a direct impact on you. So take a second and just think about that micro system. What is part of your micro system? You might have, if you're in a relationship, um, again, it could be a romantic relationship, just could be friendships, religion, your identity as a student, or whatever it is. Um, Another way to think of it is things that are important to you and have a direct impact on you. That would go into that micro system. In all my years of teaching, we often talk about wait time, right? And trying to get that. What's the sweet spot of enough of a pause to give folks time to do what you're asking, but not so long that we're just standing here spinning our wheels. So, and just in the interest of time, I'm going to roll along pretty quick here. So then you want to think about, well, what's part of your meso system that at this meso level. This could be neighborhoods. These days I don't know that neighborhood. I don't know. Neighborhood isn't quite as much of an identity as it may have been sometimes in the past or in some areas, but like maybe your neighborhood is important to you. But this would be certainly things like schools, local organizations, um, you know, larger groups of people. Like we said before, maybe you're part of a sports team or a club at school. Maybe you're on the debate team or the soccer team, or you're part of Model United Nations or something like that. Um, so branching out a little bit from your own individual identity to these slightly larger groups that are part of your life and have an impact on your life. And then, of course, you want to think about the macro system. All right, now this one might be sometimes it's harder to kind of understand that macro level, depending on your age or sort of how much you feel a part of the community. But this could, like I said, school policies. Maybe your school has an attendance policy that you can't miss more than 5 days or something like that. Well, that's going to affect you, right? Especially if part of your microsystem might be you have some health challenges or maybe a family situation that makes it harder for you to get to school, right? And so then we have this macro system, which is policies and procedures that are going to be connected to that. And your situation as an individual might be affected by those other policies. So it could be healthcare systems, right? If you have any kind of chronic illness and you need care, or maybe your parents are in that situation, or caregivers, or whatever, those things are going to affect you. Also, and this is something that a lot of social work students at first don't quite make these connections, laws and legislation. Right. We require students to take policy courses. And I talk to students all the time. They're like, oh, why do I have to learn this policy stuff? Why do I have to look up stuff in the Michigan State Legislature? Um, because those policies do affect the system, the larger community, and that trickles down to affect individuals. And what social workers really try and do is look at this whole system and then say, what can we tweak? Right? During the assessment part, it's like, what's the situation that is contributing to this individual's situation? And then how can we intervene to try and make changes to hopefully improve things? Um, so when we get into like political advocacy and political subcultures and all this stuff are part of the macro system. So it's the bigger picture. So if you have done this and you see yourself in the middle and you kind of see these other levels, the key is how do all these things affect you, right? And so when social workers, if they're doing clinical therapy and sitting down with the individual, they want to look at that big picture and say, how are things affecting the individual? Or social workers might choose, I want to focus on this macro system and help change the policies so that it's going to be better for these individuals, so that the social workers that are doing that clinical therapy, um, can have more tools at their disposal to intervene for these interventions to help these individuals. It all works together. That's the beauty of systems theory. Everybody is a person in an environment, right? So what we do is try and understand everything from that individual to the larger environment. So that's kind of the shtick. That's the skills lab. I have just a few minutes left. I do want to show that, well, there's one kind of phrase that we talk about a lot that I want to mention, and then I've got a 2-minute video, and that might still leave time for questions. Um, we talk a lot about research-informed practice and practice-informed research. And we really try, I think we succeed a lot, particularly at Wayne State, in that the sort of working together between the research part of things and the actual practice part of things, right? We want our social workers to be engaged in research, to be out there in the academic world, breaking stuff down, doing the research, publishing. But in our view, that's important as it relates to social work practice, right? The research for its own sake is not as worthwhile to us as research that informs practice, right? How can that research help us be better social workers day to day? And the flip side of that is our practicing social workers need to be utilizing best practices that have been analyzed and discussed and debated and worked out through that research. So, going back to where I started, some people just say, I want to help people. I don't need to worry about statistical analysis and research strategies and all that. But it's part of our curriculum a little bit because you have to be aware of how that works so that the research can inform your practice. And for those that come into this as pure academics and really want to focus on the research, we say, well, that's only useful to us as it can inform practice. So what it says there is we develop social work practitioners, we conduct research, and foster um, community engagement. All right, still good on time. Let me give you here's a little, it's sort of a promo. Oh, let me see if I can get this. Sort of a quick promo. Um, give you a sense of stuff that we value at Wayne State School of Social Work.
Hi, I'm Dr. Athena K. Berry. I'm a faculty in the Wayne State School of Social Work, and I'm proud to be Warrior Strong. My motivation to be a mentor and to even do teaching was mostly out of a sense of wanting to pay it forward and give it back. Wayne State School of Social Work is different and unique because we are situated right in the heart of Detroit, which makes us very strongly community oriented. A lot of our partners that we work with, our students do practical placements right here in the city. So they're going from the classroom straight to their practicum. I also find that the students here at Wayne State are very motivated and have their own real world experiences, and they bring that to the classroom, and it makes it a really rich learning environment. Almost in every single course that I teach, I try to think of some creative way to bring a real world example. In my behavioral health and criminal legal systems course, for example, I do a semester long mock investigation where students act as the mitigation specialist, the social worker on the defense team to represent a capital client, so that when they go home, they're thinking about how these issues can impact a real person's life. My hope for they leave my classroom is that they have both the knowledge and understand the data, because social work is a science. My biggest advice to students who are considering a career in social work is to identify what makes you passionate about the population you want to work with, and to have a greater understanding of how your profession will impact your personal life, and in what ways will this career provide meaning and satisfaction in the long term. The work we do in social work is challenging, but it's extremely rewarding.